Welcome back. Correspondent Olga Villaverde is here to learn more about an innovative way to help patients with knee osteoarthritis manage their pain.
More than 20 million Americans are suffering from knee osteoarthritis. That's a type of arthritis that occurs when flexible tissue at the end of the bone, it starts to wear down. Now, while there's no cure for osteoarthritis, there is hope for patients suffering from knee pain. It's a single injection treatment that is improving the lives of millions of people worldwide. Joining me today to talk more about this FDA-approved treatment is Dr. Vinod Dasa, Vice Chair of Clinical Orthopedics, LSU School of Medicine. Welcome, doctor.
Thank you, Olga.
Thanks so much for being here. Osteoarthritis, what exactly is it?
So osteoarthritis is essentially wearing away of the cartilage in the knee.
Let's paint a picture for our viewers. Let's show them here on the left, a knee without osteoarthritis, and on the right, a knee with osteoarthritis. Tell me the comparison of both.
So if you look at the knee on the left, what you'll see is that nice, smooth, white, shiny surface on the end of the bone. That's good, healthy, normal cartilage. Now, as we get older and the knee becomes more damaged, what you see on the right is that smooth, white, shiny stuff starting to wear away, and there you can start to see the bone underneath starting to be exposed, and that's when we start having problems.
All right, let's take it a step further. You brought a prop here of the knee.
Sure.
Show us, if you can, what exactly is happening. And I know it can be very painful for patients as well.
That's right. So if we look at this model right here, this is the smooth, white, shiny cartilage I was talking about. And as you develop osteoarthritis, kind of wear and tear, almost like the tire on your car, this smooth, white, shiny stuff begins to wear away. And eventually, when it gets bad enough, we're looking at the bone underneath. So if you can imagine sandpaper rubbing on sandpaper, it's not very pleasant.
No, it's not.
And so,
what causes this, doctor, and what are some risk factors? I'm going to assume genetics is something.
yeah, so genetics is important. You have obesity, so staying healthy, exercise, being fit is extremely important in helping with this.
What are the symptoms for patients when they start developing it?
So the most common symptoms are stiffness, pain, and swelling. Right? So as arthritis progresses, those symptoms become worse. So typically what I hear from my patients is they have trouble getting out of bed in the morning. They'll have trouble getting up from a couch or from a toilet. They have more and more trouble going up and down the stairs. Other symptoms are when you're getting up from bed in the morning, your knee is stiff, it's painful, it's swollen.
And people just struggle.
They struggle getting up.
It's really awful.
That's right. And they don't necessarily realize that in the beginning, and then eventually it gets bad enough, and that's when they start coming to see the doctor.
So when a patient is diagnosed with osteoarthritis, what is the first line of treatment?
So typically most patients will self-treat initially at home, right? So typically it's Tylenol, anti-inflammatories.
Do they work?
They work in the right patients early on, absolutely.
It's almost like a Band-Aid, if you will?
That's right. And, you know, they try to exercise, stay healthy, right, lose the weight. Some patients will get knee sleeves and knee braces. When those stop working, that's usually when they start seeing their primary care physician early on, and then they start prescribing maybe stronger medications like anti-inflammatories at a prescription strength. What we want to do is try to avoid using opiates and narcotics, right? We know we have a major issue here in the U.S. around that. So if we can find other strategies to manage this, we can try to stay away and reduce the use of opiates and narcotics, which is where then we transition into maybe stronger or more invasive treatments like steroid injections and now the hyaluronic acid injections as well.
All right, you mentioned steroids. I know there's a lot of, people that just say, I'd rather not do the steroids, There's some plus, there's some negative, you say?
That's right. So steroid injections are an excellent treatment in the right patient. So they help reduce the pain, they help reduce the swelling, the inflammation, but the problem is at the doses that we give steroid injections currently, they can be pretty harmful to the cartilage that's in the knee. And don't forget, we inject a lot of other things with the steroids. A lot of times we'll inject numbing medicine with the steroid injection, and those can be potentially harmful to the cartilage as well. And so because of that, we now have even better options than steroid injections, and these are the hyaluronic acid injections that have come out.
All right, more specific is Durolane, right?
Durolane is one of the newer injections on the market, and when we use it in the knee, what we find is it helps reduce the inflammation, helps reduce the pain. More importantly for me, there's some biological data that actually shows it may help protect some of the cartilage as well. So Durolane's an interesting newer medication that was approved recently by the FDA, where they learned from the previous injections and realized some of those injections are only staying in the knee for 1 day, 2 days, less than 1 day in some instances. And the engineers actually designed a new modern age hyaluronic acid injection where, according to the research, it can actually stay in the knee up to 1 month, which is really interesting.
So there's a lot of benefits to this for that patient.
That's right. And so because it can stay in the knee for so long, we don't necessarily have to bring the patient back every week for 5 weeks now. We actually have a single injection where it's kind of one and done.
What are you hearing from patients?
So the patients love it, especially the patients that have an active kind of on-the-go lifestyle. They come in, they have the right symptoms, they're the right patient. We can inject them with one injection and they're back on the road doing what they need to do.
Fantastic. Side effects with Durolane?
So really, if we look at the research, the main issue is actually from the injection itself. Some tenderness, some local swelling, some bruising in the area. The research shows that's the biggest issue with these injections, as you would expect.
So to wrap it all up, your takeaway here, if somebody's suffering from osteoarthritis, you would say?
I would say see your primary care physician or your physician that takes care of you. Come up with a nice game plan where we can address early on the symptoms and then move to more advanced treatments as the OA progresses.
For our viewers who'd like more information on Durolane, where do they go?
They can go to oakneepainrelief.com or durolane.com. Two excellent resources for our patients.
Fantastic. Thank you so much. And if you'd like more information, of course, you can always go to the website accesshealth.tv.